Hello everyone, and welcome to today's lesson on the reprocessing of our laparoscopes. We will review the entire reprocessing procedure from pre-cleaning at point of use to decontamination, assembly, and lastly through to sterilization. We are going to begin with pre-cleaning in the patient care area. Therefore, directly after use, remove any coarse soiling from the external surface of the laparoscope. Then, slide the laparoscope into the scope protector until it clicks or locks in place. Then, place the secured laparoscope into a closed container and safely transport to decontamination. It is very important to use a scope protector in order to protect the rod lenses and light fibers as they can be damaged easily. By utilizing a scope protector and closed tray, it will tremendously help with preventing damage as well as environmental contamination during transportation. Now we're going to begin the disassembly and manual cleaning process. To disassemble the laparoscope, you're going to remove the light cord adapter by unscrewing it from the laparoscope. To begin manual cleaning, you're going to gently transfer your laparoscope into your enzymatic solution along with its accessories. You're going to soak for the recommended period of time set by the enzymatic manufacturer's guidelines. It is always a good idea not to add other instruments onto the laparoscope. You should also always clean the laparoscope by itself, as this will prevent the damage to the scope. After the soaking time has elapsed, clean the exterior of the laparoscope by using a soft cleaning utility brush while keeping it submerged in the enzymatic solution. To finish up the manual cleaning process, thoroughly rinse the instruments with demineralized water for 20 seconds or in pulsed mode with 5 pressure surges using a cleaning gun. Here is where we advise that you rinse as many times as possible because you do not want a situation where some of the enzymatic solution is still on the laparoscope and it goes through the sterilization process. If this happens, the enzymatic will be introduced into the patient and might set off an allergic reaction. So you want to make sure that you're rinsing with copious amounts of water as many times as possible. So now that you have completed the manual cleaning process, you're ready to transfer the instruments into the disinfectant solution. It is important to note here that according to the IFU, manual cleaning should be followed by manual disinfection. However, per Germany, if manual cleaning is being followed by terminal sterilization, then manual disinfection can be omitted. With that being said, some facilities still require manual disinfection. If this is the case, completely dry the outer surface of the laparoscope using a sterile lint-free disposable cloth. Then gently transfer the laparoscope into your disinfectant solution along with its accessories. You're going to soak for the recommended period of time set by the disinfectant solution manufacturer's guidelines. To finish up the manual disinfection process, thoroughly rinse the instruments with demineralized water for 20 seconds or in pulsed mode with 5 pressure surges using a cleaning gun. Here is again where we advise that you flush the laparoscope with copious amounts of water as many times as possible. If manual disinfection is not required, manual cleaning needs to be performed before machine cleaning and disinfection. So now that you have completed manual cleaning and disinfecting of the instruments, you're ready to transfer them into your washer disinfector. Place the laparoscope and its accessories into their appropriate trays in the washer disinfector. Then carry out appropriate thermal machine disinfection following the national requirements. The next thing that we're going to begin is the drying process. To begin, you're going to use a soft, lint-free disposable cloth to dry the exterior of the laparoscope. This is a heat-stable instrument, which means it can go into the steam sterilizer. However, we advise that it does not go in soaking wet. That's why it is important that when you receive the laparoscope in the assembly area and you're drying it, you ensure the external surface is completely dry. Then clean the glass surfaces with a swab soaked in 70% isopropyl alcohol. So now that you have performed your drying process, the next thing is to inspect the instruments. There are certain things that you need to do to the instruments in order to ensure that they are functioning correctly. As a technician, it is your responsibility to make sure that the instruments you're sending to the OR are in good working condition. So what are some of the items or the things that you do to the instruments to ensure that they are functioning correctly? You're going to perform a visual inspection of the laparoscope. You're inspecting the exterior of the laparoscope to make sure that there is no bioburden on it, as well as to see if there are any cracks, dents, or scratches. In addition to this, use your finger to feel the entire shaft of the laparoscope to see if there are any scratches or dents. After that, you're going to pay attention to the distal end. Sometimes the distal tip might have a snag. This is very important that you check for the distal tip because this scope goes into a patient. So if there is a snag or if there is any roughness at the tip and it is being pushed through into a patient, it will cause trauma to the patient. So you feel the tip to make sure there is no roughness. After you have performed the exterior inspection, the next thing you're going to do is check for the optics and the light capabilities. To check the optics, you're going to look through the eyepiece and point the distal end to a very sharp image. What you're looking for is to see a clear picture. If you see fogginess or a blurry image, you can use an alcohol swab to wipe down the tip of the laparoscope. Sometimes water will just dry on there and it will cause a vision impairment. If the problem still persists, you can always reach out to some of your colleagues and find out if they can also take a look to see if indeed something is wrong with the optics. After you've done the optics inspection, you're going to look at the light capabilities. To do that, you're going to point the distal end of the laparoscope to a light source and look at your light post. What you're looking for is a full moon shape with very clear white light. If you see a lot of black dots, also called peppering, anything more than 30% indicates that there are broken fibers in the shaft of the laparoscope. If you see something more than 30%, it is going to potentially impair the vision of the surgeon doing surgery, so you have to take it out for repairs. We now know that the laparoscope is in good working condition, so the next thing you're going to do is to assemble the laparoscope and prepare it for sterilization. Loosely screw on the light post adapter. Here, we always advise that you turn it 1/3 of a turn when screwing it on. This will allow for the steam to penetrate through the threads during sterilization. Therefore, do not fully screw it on. Then slide the laparoscope into the scope protector until it clicks or locks in place. It is important to note here that our laparoscopes are validated to be sterilized with the scope protector on. Now that the laparoscope has been assembled, you're ready to place the laparoscope and its accessories into their corresponding holders in the reprocessing basket. Ensure that the secured laparoscope sits securely in the brackets and wrap the reprocessing basket for sterilization. Sterilize the wrapped products using the fractionated pre-vacuum method, taking into account the national requirements. A temperature exposure time of 4 minutes at 270 degrees Fahrenheit plus 7 degrees Fahrenheit. Evacuation of 3 times, a drying time of 20 to 30 minutes, and a maximum sterilization temperature of 138 degrees Celsius. Lastly, the sterilized instruments should be stored in a restricted area. Here at Richard Wolf, we offer scope protectors that come in 2 different working lengths and come in a pack of 5. Next, we offer a steam sterilizable soft utility brush for cleaning external surfaces. And lastly, we have 2 different laparoscopy trays that are indicated for packaging and sterilization: the general laparoscopy tray and the long laparoscopy tray.
For more information, please contact a member of the Clinical Services team or the General Surgery team. Thank you.